For men, how do you determine what level of testosterone is optimal?
I think that's somewhat of a complicated question, as much as it may seem like a simple question. The free testosterone is really the active testosterone, but it is something where we have to pair that with what the person's symptoms are and whether they are having issues that they think are going to get fixed by increasing their testosterone. And those are the discussions that need to come into play in regard to sorting out what is optimal. Some men are much happier in the top 90 percentile. Some men are very comfortable in the 20th percentile. But when it is frankly abnormal, when it is below range, then it is something where a lot of times we're really going to recommend supplementing in one fashion or another.
For those who have a suboptimal free testosterone level, what are their options?
There are a number of options, and I think one of the biggest things is not to jump to direct supplementation of testosterone right from the get-go. There are patients in which that may be indicated, somebody who's quite elderly, somebody who already has an elevated FSH or LH, and they're still not producing enough, but that's not our most common patient. So it is something where first we try and get your own testicles to make more testosterone, and there's lots of methods to do that, and has the advantage of preserving testicular size and preserving fertility in most cases.
How do you determine which option to use given the range of oral, topical, and injectable options?
It's complicated, and there does need to be a discussion with the patient and what their previous experience has been and what their previous treatment has been in regard to this. But for a new patient, I'm going to tend to use things that don't do anything irreversible, and giving testosterone directly can be an irreversible approach, especially if you're not doing things to keep the testicles stimulated, such as either HCG, clomiphene, enclomiphene, ganatorenin, for example, a number of options out there. So we usually talk with the patient about their symptoms, what their preferences are, and we can look between topical therapies, injectable therapies, oral therapies. There are a range, but it is a complicated discussion and involves use of significant lab work in order to establish what the patient's baseline is.